Good evening to all of you. So today we are here for our next lecture on the subject of Organon. So we have done until aphorism 276. From some time we have been talking about the dosage, what are the large doses, why they should be avoided, how they can be harmful, and we have talked about the small dose, that what should be the appropriate quantity of dose which we should give. So we will talk about in the next coming aphorisms about the dosage, that what is the small dose or why it should be preferred over the large doses. We have done the major thing about it, but there are some minute things, some brief details which Dr. Hanuman will give in the coming organ organon aphorisms. Okay. So we'll start with it. So we'll start with aphorism 277. So for the same reason, and because a medicine, provided the dose of it was sufficiently small, is all the more salutary and almost marvelously efficacious, the more accurately homeopathic its selection has been. So we know that once we have chosen a medicine which is homeopathic in its selection, which is similar to the symptoms present in the case, we have chosen a right medicine. After that, so it is a very marvelous, that will be a marvelously efficacious medicine because its selection has been homeopathic to the case in front of us. A medicine whose selection has been accurately homeopathic must be all the more salutary the more its dose is reduced. So it will have a salutary affection, it will have a very wonderful affection or a very wonderful action on the case if the dose is reduced to the degree of minuteness. If we can reduce the dose to the degree of very, very minute dose, then it can become more salutary, it can become more effective in its action. Salutary means that it will give a good effect without giving any more bad effect to the case. So homeopathic selection plus the minuteness of the dose, it will give a gentle remedial effect. So the ideal cure which we have read in the second aphorism, so for that ideal cure to come, the homeopathic remedy or the selection which we have made should be homeopathic, and the dose should be very, very minute dose. Okay, only then we can bring out a gentle remedial effect. I recently had a patient. I give small dose, like it is only one globule of the medicine which we give at one particular time. So that has been the practice from a long time. So to that person also we gave that one single this globule of medicine. But now this all is a learning process. The way we learn medicine, how to practice in the clinic. So he got a strong homeopathic aggravation after the very small dose, which according to us is a small dose. Okay. So even with that, he got a very strong homeopathic aggravation, which needed to be remedied, which needed to be antidoted. He had a very bad rash on his neck area and the cervical area, and it was very painful for him. So, but after giving the antidote within few minutes, I think 10 or he was good after that. So that confirmed that it was the homeopathic aggravation, first of all. And in some cases, even one like Dr. Hahnemann will talk about it in the coming cases, that in the patients who are very, very sensitive, okay, in them, you have to even make this dose more minute. Okay. So he will talk in the next coming aphorisms about this thing. So just because I recently had this experience in the clinic, so it came to me. And one more experience with one of my patients. whom I told to take a certain medicine in a very minute dose, but she could not understand that part of making it minute or by diluting it. So she took the whole drop of the medicine which was told to her, and again she got a very bad homeopathic aggravation. So when you see those things happening, then you can realize with what kind of experience, although Dr. Haneman's experience would have been a lot more than what we experience in our clinics, but at least you can see a glimpse into that kind of experience with which this organon is written. Okay, so we'll go to the next part. Here the question arises, what is this most suitable degree of minuteness for sure and gentle remedial effect? So he says that now the question is that Dr. Hahnemann is saying from a long time, what is, we should, the dose must be minute, the dose must be small, the dose, oh, what is the minuteness? How minute it should be? Okay, what is the suitable degree of minuteness for this sure and gentle remedial effect? How small, in other words, must be the dose of each individual medicine homeopathically selected for a case of disease to affect the best cure? So, how small should the dose be? So, to solve this problem and to determine for every particular medicine what dose of it will suffice for homeopathic therapeutic purposes and yet be so minute that the gentlest and the most rapid cure may be thereby obtained. To solve this problem is to solve this problem is, as may easily be conceived, not the work of theoretical speculation. So, to solve this problem, Dr. Heyman says it is not that you can speculate the minuteness of the dose. It is not a theoretical question. Okay, it has to be gained by reasoning and by experience only, by experiments only, not by fine spun reasoning, not by specious sophistry can we expect to obtain the solution of this problem. So by reasoning out or by making some good words or some kind of good speech, we cannot obtain the solution to this problem, that how minute a dose should be to effect a gentle and permanent cure. So how we come to that conclusion? Pure experiment, careful observation, and accurate experience can alone determine this. And it were absurd to adduce the large doses of unsuitable allopathic medicines of the old system, which do not touch the diseased side of the organism homeopathically, but only attack the parts unaffected by the disease, in opposition to what pure experience pronounces respecting the smallness of the doses required for homeopathic cures. So he says that the only way to understand what is the minuteness of the dose, like whenever I talk about this dosage or how small should be the dose or how much should be the potency, I always say that, you have to experiment. Although Dr. Henneman has told us, but we on our part also have to experiment. Like I told you about this experience recently. So when we see very carefully what is happening, and then we had one of such kind of experience in Brazil also. A very small girl came for some acute problem, and when the medicine was given, she got this bad homeopathic aggravation which needed to be antidoted, and the medicine had to be given in some other way to her. So I have seen patients getting better with olfaction also, a simple one olfaction of the dose, one small rub on the skin also of a very small amount of medicine, one globules also, sometimes one globule diluted in the water also. So there are many things which you can experience and experiment with. And I always say this thing that dosage and potency, it comes with the experience in your own clinic. When you are seeing, yes, someone can tell you about this thing, but there is more to these things which you need to experience day by day, which you need to understand day by day. Okay. So aphorism 279, this pure experience. So Dr. Hanuman is saying that only way to understand this is pure experiment, careful observation, and accurate experience. This is the only way how we can understand about the dosage, how minute it should be. Okay. And as he has already explained in the previous aphorisms, that it is absurd, it is useless to adhere to the large doses because they are unsuitable medicines, even if you are giving it homeopathically. And if the medicine is homeopathic to the case and you are giving a large dose, like I told you about this recent experience, it will bring out a bad result. Okay. So, yes, if your medicine is unhomeopathic, it is not even related to the case, you can give any large amount of dose, and that will not produce much change in the patient, not on the positive side, not on the negative side, because it does not touch the uh, diseased state in any way. But it is, if it is homeopathic, then it will certainly produce a very strong primary action in the body. So this pure experience shows universally that if the disease is do not manifestly depend on a considerable deterioration of an important viscous. So what does this pure experience shows? That if the disease is not very much deteriorated by the deterioration of some viscous, if the disease is not depending upon a condition where some organ is very chronically deteriorated, or it is has like destruction going on, and complicated diseases, even though it belongs to the chronic and complicated diseases, and if during the treatment all other alien medicinal influences are kept away from the patients, and all the medicinal influences are any kind of medicinal influence is not affecting the patient during the treatment. So these two conditions, if they are met, the first condition, if the disease is not dependent upon some deteriorating organ, some organ is deteriorating and the disease is not dependent upon that thing, or any kind of medicinal influences are not given to the patient and the patient is kept away from all those things, the dose of the homeopathically selected remedy can never be prepared so small that it shall not be stronger than the disease, natural disease. It is impossible to make a remedy which can be so small, okay, which will not be stronger than the natural disease. So means, even if you go to the minutest form of the homeopathic medicine, minutest part of the dilution, and you give that medicine to someone, it will still be stronger than the natural disease. It will still have the power to cure that natural disease. So even if you put one globule in 300 ml of water and you just give 1 ml 2 ml of that thing, even that will be stronger than the natural. I'm just giving an example, this is not given in Organon, because I have tried that thing with some children who I think are very sensitive, and where I feel that one single globule will, so I tell them to dissolve one globule in 300 ml of water and just give 1 or 2 ml or some one small spoon out of it to them, and that has shown very positive results. So, so the thing is that you cannot make a dose so small that it will not affect. Homeopathically, that kind of medicine cannot be made that now the medicine is too much dissolved and it will not affect, or it will not be stronger than the natural disease. This cannot happen. On the contrary, the dilution of the dose, it somehow makes the dose or makes the medicine more stronger. Okay, and shall not be able to overpower, extinguish, and cure it, at least in part, as long as it is capable of causing some, though but a slight preponderance of its own symptoms over those of the disease resembling it. Okay. The only thing is that it should be homeopathic. The only thing is that it should have those symptoms, that preponderance of the symptoms, and they should resemble the symptoms of the disease. It will always have that power to overcome the natural disease, even in the smallest or slightest of the doses. Slight homeopathic aggravation it will give immediately after its ingestion. Okay. So in this aphorism 279, still Dr. Hahnemann has not given what is a small dose, but he gives us an answer in a way that the homeopathic medicine, if those two conditions are not there, for example, some medicines are going on, or some very deteriorating disease is going on, which is deteriorating or destructing some organ, where the vitality has become too weak. So, in except those two cases, any natural disease can be cured by a homeopathic medicine, even in the smallest of the smallest of the smallest amount prepared. You can imagine even that will be stronger than the natural disease, provided it is a homeopathic medicine selected. Okay. So from there, he's just giving us an insight that as a homeopath, do not worry about that dose being small. We should not worry about that. We should worry about dose being large. That is the thing which we need to understand. Even in the coming aphorism, he will explain it more. Uh, okay, so from this thing, this particular aphorism, we have to keep this thing in mind that we should, as a homeopathic physician, we should not by that question should not come that will this dose be enough? That should not come to our mind. It is more than enough. Okay, one globule is more than enough. If you dissolve one globule and give in part water and give a small amount out of it, it is more than enough. Okay, we should be worried that it is not large enough. It should not be that large that it produces a homeopathic aggravation, which will complicate the matters. Okay, so we should be worried about the dose being large, not the dose being small. Okay, so it cannot be made that small that it does not cause it does not cause any effect. It cannot be made that small. It will always be stronger than the natural disease, however small you make that. Okay, so with that understanding, we will go ahead. So aphorism 280. This incontrovertible axiom of experience is the standard of measurement by which the doses of all homeopathic medicines, without exception. So you should not make any exception that, okay, if you are giving sulfur, it can be small. If you are giving some other carbo veg, the dose should be large because it is an inert. No, that kind of classification should not be done. So in this aphorism, Dr. Hahnemann is making that all the homeopathic medicines without exception are to be reduced to such an extent that after their ingestion, they shall excite a scarcely observable homeopathic aggravation. Okay. Even Dr. Kent in his this 12 observations, Dr. Jonkol has made a very beautiful chart. We will present it to you very soon so that you can have it along with you when you are taking a follow up of the patient. That will help you to understand in which direction the medicine is going. So I was saying that yes. So when that Dr. Hahnemann, Dr. Kent has also given in his this observations that when there is amelioration without any aggravation or without an observable aggravation, aggravation is there, but the patient has not noted it into that sense, or the physician has not noted that aggravation happening. Okay, so he says that this is a very good thing which is happening, and let that cure be going on, a long standing amelioration is going on. So the word Dr. Hahnemann is using is scarcely observable. Very keen homeopath, if you're very keen in seeing that homeopathic aggravation, then you can observe. Otherwise it will be so minute that sometimes the patients also don't observe that kind of aggravation, and the amelioration starts right after that words. But it happens if you are a good observer, if you can understand, if you can question the patients about those first few hours or few days of taking the medicine, they will let you know that yes, a slight here and there I used to feel a little increase in some symptom or the other symptom, but that was not bothering. So they shall excite a scarcely observable homeopathic aggravation. Let the diminution of the dose go ever so far and appear ever so incredibly to the materialistic ideas of ordinary physicians. Okay, so he's saying that let the diminution of dose go ever so far. Let's reduce the dose that much that the materialistic the ordinary physicians who think in a materialistic way, it should appear incredible to them that in this kind of small dose, a medicine can work. And it works wonderfully. The experience tells this thing that it recently one more experience. There was this case of paralysis of around 57-58-year-old man. He had this necrosis of his spine, and mm, I think 5 or 6 vertebrae, they were dislocated and they were spaced out, and he was on bed from past I think 1 year, and he would get need help to get up, to be taken for the washroom. He was not able to walk properly. His left leg will cannot bear any weight, right leg can bear a slight weight, and but it was very difficult, and numbness of the there was no sensation. So he could not come to the clinic. One of his friends who was taking the medicine, he consulted with me and Dr. Vidya. We were there in the clinic, and after talking with him on the phone and taking his case, we gave him some remedy. So after that, he started getting better. One dose was given, and we did not repeat it for 2 months. We did not repeat it, and now day before yesterday, he came himself in the clinic. Uh, he walked around, although he needs some help, but he said, now I am feeling independent. So this appears very incredible that one globule given 2 months back is making the patient better without any medicine further. One simple globule of one medicine, which was given, and it has continued effect for 2 months, and now third month has started. We have not repeated the medicine. We have given the SL to the patient, and so this is what Dr. Hahnemann wants to, feel for a homeopathic physician or for the other physicians, that it appears so incredible that one so small dose can start the effect and can continue the effect for so long time, and even in such kind of cases. Although Dr. Hahnemann has before said that if the organ is not deteriorating, if the organs are deteriorating, he is on the medicinal, taking the painkillers and everything, because he was not able to bear pain. Right now, he is not taking, he stopped all the painkillers because he is not having that much of pain. But at the when we started with the medicine, he was taking 3 different kind of painkillers because the pain was so severe in the back, in the legs. The pain was very severe. So this is what he's talking about, that let that idea, let that thing be an incredibility, a miracle, or some kind of wonder, that one small single dose, very diminuted dose, very small dose, can produce such kind of effect on a human being. And we have the patients are being given so large doses with so less effect. One painkiller of around 500 mg, 500 milligrams, one painkiller, if given to a patient, it can reduce the pain for 5 to 6 hours only. That much is only the effect. And here, a very small globule whose weight will not even be more than 1 mg, and the medicine is still very, very less now in micrograms, I don't know. And it is producing an effect on a human body which is lasting 2 months, and the third month has started. I have many patients whom I have not repeated dose. I think maybe year have passed, or 10 months have passed. One small dose given where, and the amelioration is going on still. So this is the difference which Dr. Hahnemann has been trying to tell us in this aphorisms of the organon, this kind of experience. So their idle declamations must cease before the verdict of unerring experience. Okay. Even now, there are questions which come that there is no medicine in homeopathic medicines. I don't talk about this, because talking about that feels nonsense after you have experienced such things. But still, because like when we started with the organ, or when I talk about the homeopathy somewhere with the doctors, I always say that if you want to understand homeopathy, if you want to learn homeopathy, you have to keep aside all those materialistic ideas where quantity is important. There is nothing quantifying in homeopathy. It is a qualifying thing. Whatever things qualify as an experience, those matters in the homeopathic practice of medicine. So we have to put experience as our guide. And this book is written completely out of experience. I can say that because I have seen these things happening. I have seen many of these things happening in my clinic, in my life. I have personally seen, I have seen these things happening on the other people. I have given numerous examples about it. Every time I take a lecture somewhere, give a seminar, I have new experiences with me, which I have seen in those times. And that makes your belief, in the thing that yes, these things happen. I can say that this thing happened. And this is the difference which Dr. Hahnemann is talking about in this whole organ. And that is what he wants his the homeopathic physicians to understand. Okay, that this unerring experience is the guide, and that is what should tell everyone that this is how the homeopathy works, this is how the real cure can come. So footnote to aphorism 280, because these things started happening at Dr. Hahnemann's time. There were many people who was criticizing him for giving very, very small doses. Okay, so for them, like he wanted them to know that try this thing, and you will know from your experience that whether this thing works much better or not. But with us, the people, we have belief systems. If someone believes in materialism, if someone believes that a matter is the most important thing, he will not even try the other thing. So that was the main issue or main problem with Dr. Hahnemann, that even in this part, in the footnote, he will talk about it. That what are you going to lose if you try it? If you just experiment with it, what are you going to lose? But the physicians at that time were not even ready for that thing. So let them learn from the mathematicians how true it is that a substance divided into ever so many parts must still contain in its smallest conceivable parts always some of the substance. So he's saying that even mathematicians, they can tell you that even if one small part is subdivided, divided many times into something, even then some substance of that part always remains, and that the smallest conceivable part does not cease to be someone of the substance and cannot possibly become nothing. Okay, and that small substance which is still there, it will not become something else, or it will just vanish. It cannot happen. Let them, if they are capable of being taught, hear from natural philosophers that there are enormously powerful things, forces, which are perfectly destitute of weight. Okay, so he said that these natural philosophers, these philosophers which study which the nature, they can tell that there are so many powerful things which we call as the forces, which are which do not have any kind of weight, but they are very powerful. For example, caloric, light, etc. Consequently, infinitely lighter than the medicine contained in the smallest doses used in homeopathy. So he's saying that those things have so much force, this light and the caloric power, that they are lighter than the homeopathic doses. They weigh, they have no weight, but still they are stronger. Let them, if they can, weigh the irritating words that bring on a bilious fever. He said that I am telling them you to weigh on a machine, to make a matter of it, those irritating words which can bring a bilious fever. So he had that experience that these emotions, these kind of things, they bring out the diseases. That is why he gave so much importance to what kind of behavior or what kind of disposition a patient carries. So he's challenging all those people who have materialistic mind to weigh these things, to weigh the emotions, to weigh those irritating words, or the mournful intelligence respecting her only son that kills the mother, or some mother's mournful intelligence, okay, who is bereaved of her son, and that will find that eventually kills the mother also. That grief, he's saying that weigh that grief of a mother if you can. Let them touch for a quarter of an hour a magnet capable of lifting 100 pounds of weight. And he's challenging them, he's asking them, just touch the magnet for quarter of an hour, for 15 minutes. Just touch it and learn from the pain it excites that even imponderable agencies can produce the most violent medicinal effects upon man. He's not telling them to, hold, like carry them, that magnet, just touch it. And he says that you will learn from the pain it causes, it excites in you. Then you will know that even the imponderable agencies, the agencies which are not experienced as matter, the gravitation or the magnetism, that those kind of agencies can also have very violent medicinal effects upon the man. And let the weak ones among them allow the pit of their stomach to be slightly touched by the thumb's point of a strong-willed mesmerizer for a few minutes. And he's saying that the weakest people in those group of people who are materialistic, let them get their stomach, the pit of the stomach, touched by a mesmerizer for a few minutes, and the disagreeable sensations they then suffer will make them repent of attempting to set limits to the boundless activity of the nature. So, by giving these examples, he is basically telling us about this boundless activity of the nature. There are many things in the nature which the science has not understood. Usually, the people, they put science against the nature or the god or whatever you call it, that they are two opposite things. But it is not opposite. Nature exists. The whatever the universal system is there, whatever we call it, by whatever name we call that thing, it exists. Science works on exploring it. So the people who call themselves that they are very scientific, and if they have put boundaries, then they are not scientific people. Because the work of the science is to explore the opportunities, explore the things which are there in nature, which a human mind has not yet understood. If a scientist says that no, I do not believe in this thing, okay, without experiencing that thing, without experimenting with that thing, if a person say that I, then that person is not scientist or have a scientific temperament. However degrees he has done, as many experiments he has made, okay, so that means that he does not have. A true scientist can never say, or a true science person can never say that this cannot happen, because in nature everything is possible. So there is a boundless activity of nature which is going on. And if some person is saying, see only the materialist part of that nature of the whole thing, then he is looking at a very, very small part of the whole. And that person cannot be judge of anything. And that is why I started with this thing, that I don't talk about that thing, that homeopathic medicines do not contain medicines, because those are the uh, statements given by the people who don't have a scientific mind. So we should not bother about that thing. The weak minded creatures, this is the name which Dr. Hahnemann has given to them, the weak minded creatures. If the allopathist who is trying the homeopathic system imagine he cannot bring himself to give such small and profoundly attenuated doses, let him only ask himself what risk he runs by so doing. So he's saying that, okay, what risk will happen? Like if you give small dose, if you get attenuated doses which are very small, what is the risk? Most what can happen is that it will not work. So that's okay. It will not produce any kind of bad effect. What is the risk? Okay. So again, if the allopathist who is trying the homeopathic system, if some physician is trying the homeopathic system, imagine he cannot bring himself to give such small and profoundly attenuated. Let him only ask himself what risk he runs by so doing. If this skepticism which holds what is ponderable only to be real and all that is imponderable to be nothing, be right, nothing worse could result from a dose that appears to him to be nothing, then that no effect would ensue. So if even if he gives that dose, nothing will happen because according to him, there is nothing in that. So from nothing, nothing can happen. So he's just asking him to try it. And consequently, this would be always much more innocuous than what must result from his too large doses of allopathic medicines. So he's saying that this will be less harmful, means not at all harmful, than the large doses which you are already giving. So it cannot bring more harm than that. Why will he consider his inexperience coupled with prejudice more reliable than an experience of many years corroborated by facts? So he's saying that he is prejudiced, he is already into that materialistic mindset, and he's giving it more importance than the experience and the facts. And moreover, the homeopathic medicine becomes potentized at every division and diminution by trituration or succussion, a development of the inherent powers of the medicinal substances, which was never dreamed of before my time, and which is of so powerful a character that of late years I have been compelled by convincing experience to reduce the 10 succussions formerly directed to be given after each attenuation to 2. So he's saying that this trituration and potentization which we are doing, it makes the medicine more powerful. Like I was saying, that the more you dilute it, you will find it to be more efficacious. Okay, and this happens. And he's saying that this thing is so powerful that I have been compelled. I that Dr. Hahnemann used to say that give 10 succussions. Now I have seen this thing to be so powerful that I advise to give only 2 succussions. In one of the previous aphorisms we have studied, he advises the physicians not to take the liquid bottles in their bags because by that, to and fro motion, they are getting more powerful. Okay. So with this, we will stop at aphorism 280 today and we will continue from it next time. So with this, Dr. Hahnemann, what he is giving from his experience to us is not to be afraid of giving small doses. At the most, they will not act, but that does not happen according to his experience also, but according to our experience also. Because if your medicine is right, it is going to affect or act in a wonderful way if the medicine is small. And sometimes it is like, you know it it is wonderful. Like I was giving you experience of a recent origin of this medicine to a paralysis person, that one small single dose, when it can cause such a beautiful effect, why we need to give multiple doses? The question comes to a mind, a reasoning mind. This question comes, why to repeat? Why to give again and again and again medicines when one small dose of a right medicine? The problem is to find the right medicine. And that can be overcome by a continuous study of the materia medica. That's it. A continuous practice and a continuous study of materia medica, that can be overcome if we have that instinct of hard work in us, if we have that instinct of discipline and persistent or this perseverance in us, that can be overcome. Okay, so that small thing, that study thing should not be an obstacle to witnessing something which is so wonderful. So I always say that in India, I joke that, many students, they were trying to get into allopathy and they come to homeopathy because they could not get the admission in that particular college. But I always tell them that it was your good luck, that you did not went there, because then you will not have experienced this beautiful science. So with that, I will take your leave, and I will request you to go through these aphorisms once again. And if there is any uh, mm, difficulty in understanding of anything, we can talk about it again. Okay? So with that, I will thank you and have a good night.